Emilia. Emi.
Yes, sir. I
Yeah,
can
was
hear
that
you.
it? Yeah, you can hear me. We already have 40 people waiting. If Hemal ma'am joins, then we can start over this.
So she's joining in a few minutes. I've already called her.
Oh, so we will start allowing people inside, right? Hemal ma'am, good morning.
This is not coming. Hello?
Yeah, Hemal
Hello?
ma'am, good morning.
Yes, ma'am. Good morning, ma'am.
Hello?
Ma'am, you are audible.
Okay, good. Fine.
We will start off, ma'am.
Yeah, we can please start. Surely we can start.
Okay.
I'm
Before,
sorry for the delay.
before,
I was not having a proper Teams account.
no problem, ma'am. No problem at all. Can you just tell me the sequence so that I don't mess up
Sure.
anything with the presentation part?
So the first is my presentation.
Okay.
Then we have the brain death video.
Okay.
And then we have Ranjini's presentation, which I just sent to Amelia.
Okay.
Grief counseling case study.
Yeah. Please.
And last is that girl's video, the recipient testimony.
Recipient's testimony.
Yeah. And
Okay,
whenever
ma'am.
you want, after my talk and after the brain death video, if you want Q&A, you can have it that time. Then Ranjini and the donation and the recipient, you can have a Q&A at that time also. You decide how you want it.
No, that's not a problem because I cannot take any poll in the Teams as of now.
Okay.
However, we can post the question in the chat box so people
Okay.
will be able to answer there and we can monitor still.
Okay. Okay. Fine. Sure. How many
Okay.
students would be
So
joining?
approximately we are expecting 130 to 150, ma'am.
Okay. Sure.
This is actually a blend of people.
Yeah.
There will be students also. There will be all grades of faculty, starting from lecturers till professors,
Yeah.
HOD, research directors. So we have a combination of people joining.
Okay. 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 Fine. ठीक है.
Yeah. So I will start allowing people inside.
Yeah. Sure. Sure.
Am I audible, sir?
Yes, yes. Yes, Simran, you are all.
Good morning, Dr. Hemal Kanvinde, distinguished speaker for today's session, faculty members, and one and all present here in this event. I, Emilia Cole, take utmost privilege to all to try a sensitization session on organ donation brought to you by the Pan Pharmacon Student Club, Department of Pharmacology, in association with Dr. Hemal Kanvinde from Mohan Foundation, along with Miss Ranjani, will us on various aspects of organ donation, like the laws and protocols governing organ donation, and also some myths revolving around the same. Dr. Hemal Kanvinde has an MSc in Life Science and a PhD in ecology. She has managing national as well as international research projects dealing with biodiversity, coastal ecology, and sustainable. She has a working and practical knowledge of social and in 2000 she trained as a transplant coordinator at the Mohan Foundation in Chennai. She has been a faculty member of transplant coordinators training for teaching national and international transplant law. She has assisted in organizing and planning medical and training workshops on brain death and deceased organ donation. At present, she is the Quality Assurance Officer of and is responsible for the running of a national helpline on organ donation. She is also responsible for public engagement to promote organ donation through training, volunteers, ambassadors, life members, and interns. Her work on organ donation has been national and international. She is also the trustee of Gold, an NGO that works for children's palliative care in Chennai. Uh, so before today's event, I will inform all the participants that your microphone has been disabled and you are requested to use your chat box option for posting any queries that you might have. Then we will start our live question answer session. When your microphone is enabled, then you can directly interact with our speaker today. With this brief introduction, I would like to hand over the session to Dr. Hemal Kanvinde. Please take over the.
Thank you, Amelia. I'm very grateful to the Faculty of Pharmacy of the MS Ramaiah University for this opportunity for Mohan Foundation to talk to all of you about a very important aspect on organ donation. This is our motto, life, pass it on. And we serve in multiple places in India. We also have a presence now in USA, where we are trying to get people to promote organ donation among the Indian communities, because abroad, a lot of Indian communities do not pledge for organ donation, but they are the major people who need organs. So we are trying to get them to pledge for organs now. So this is about us. Next slide. Mohan stands for Multi-Organ Harvesting Aid Network, and our motto is Life Passed On. Next slide. So today I shall talk about the concepts of organ donation. This is my name, Hemal Kanvinde. I've been working in this field for the past 15 years. And one of the greatest joy is about having to be able to speak to others and convert people from just thinking about it to do something about it. That is what is the greatest joy of this work that I do. Next. A little bit about Mohan Foundation. These are the places where we have offices right now. The major part of our work is grief counseling, training, as well as public awareness. So we conduct talks, just like we are talking now. We do a lot of grief counseling when we get calls of death, and we counsel the family members so that they can become organ donors and they can give their consent for donation. And we train. A lot of our training activity is for people who want to become transplant coordinators and work in hospitals and coordinate a case. That's why I requested our coordinator from Karnataka to join us to explain a case to you people. So you know what happens in a hospital at a time of donation. This training program is also available online. We have a month's training program, a year's training program. We have training program family counseling. We have training program on transplant law, how to certify brain death. So, and these programs, our training module has got an award from the British Medical Journal as one of the 5 finalists for the best training programs on medical issues. Okay? You could go online and check these also if you want to, work in the field of organ transplantation. Next slide. So this picture shows a very famous painting of a tsunami by a Japanese artist. I show this because our organ failure condition in our country is like a silent tsunami. When the tsunami hit us, I think in 1998, 2004, 2005. Yeah, 2005. Thank you. At that time, the loss of life was around 2 lakh people. But at the same time, every year around 5 lakh people need organs and only 20,000 will get it. So we are having a silent tsunami where a lot of people and families lose their loved ones and are unable to sustain life because of the failure to receive an organ. So the gap between the need and the gap between that is produced by our own community is so big that lives are lost. And that is why it's a silent tsunami. Nobody talks of it, It is not said in the medical sphere. It is not said in the public. It is not said in the medias. Nobody talks of this unless you have a World Heart Day, World Kidney Day. Only then you talk about it. Rest of the year, you are not talking. And the organ failure, most important causes of organ failure are hypertension and diabetes. 80% of all kidney failures are due to this reason itself. So I request all of you to keep healthy. I mean, your family members, if there is somebody who has diabetes and hypertension, get annual done so that there is no more need for this. Action can or reverse or slow down the organ failure. Okay. Next slide. So what is the rate of organ donation in our country as well as where do we stand? No? So you see organ donation rate is calculated as per million population. That's how you calculate it. And 2019 data says that our country has 0.52 people per million population were organ donors, while other countries we more than 10, more than 15, even around per million population as organ donors. So why is it that India has low donor rate while other countries have? There are many factors. It is not that the people are not giving. We have 35 per million population as blood donors. So we are a giving society. So what steps that 35 per million to become organ donors? It's just education and processes in the hospitals. If there is a brain dead case in my hospital, do I have a protocol set up for brain death certification, to talk to the state authority? Do I have those things? If those things are in place, organ donation can happen. If the protocols are not in place, then organ donation becomes a big headache for the hospital. Who will open the OT? What time is the OT? Is it free? Is there anybody there? Are the retrieval surgeons available? All these things matter a lot. So setting systems in place is the way to have organ donation rate increased in our country. We do not need to have any more or much work done in the public health sphere. More work has to be done in the hospital spheres now. We have reached that stage. Next slide. So what are the laws on organ transplantation? We have a single law which is called the Transplantation of Human Organs Act 1994, and it was amended in 2011. Karnataka follows the amended act. The main purpose of this act is to regulate, ensure there is no commercial dealing in organs, and the law also provided how to certify brain death and what is the process after certification of brain death. These are the main things of the law. It also stated that every hospital that needs a license should have a trained transplant coordinator and a grief counselor. So that is by law. Apart from that, the law also says how living donations can happen, what is restricted, living donations as well as disease donation. What are the procedures? The law also has rules about eye banks, tissue banks, as well as getting license and renewal of license. It also states who are the people qualified to do transplant surgeries and tissue retrieval, cornea retrieval. Who are the people who are qualified to do this? So it gives all the qualifications for people to work in the field of organ donation and transplantation. Next slide, please. All of us work under this law, The organ donation is nothing but the process of removing an organ or a tissue from a healthy person, to transplant into another. Right now, the law doesn't allow anything other than for therapy. You cannot remove an organ and take it for research or for study purpose. Organs can be given to another person by a living person or by a deceased person. So this is the basics of organ donation. Next. I said after death also. So we have two types of deaths, circulatory death as well as brain death. There's a separate video for brain death after my talk, just for all of you to realize that this can happen. Okay? So when heart stops functioning and also the circulation stops functioning, at that point, the person is called as dead, and it's called as circulatory death, no longer called as cardiac death. Organ donation after circulatory death is not at all common in India. Tissue donation is possible after circulatory death. Tissues such as cornea, skin, heart walls can be donated. Bone is also donated. Sometimes even small vessels can be donated, blood vessels. Voluntary body donation is possible for people using in the medical college. Brain stem death is defined legally as the irreversible permanent injury to the brain stem, and a person is unconscious. The brain cannot work anymore. No signals from the brain go down to the other parts of the body, and therefore nothing functions. The brain stem region is the region where has the nerve centers for blood pressure, breathing, and consciousness. So a patient whose brain stem is not functioning, is unconscious, cannot breathe on his own, and cannot maintain a healthy blood pressure. So such a patient, when he comes to the hospital with an injury, head injury, that time he is put on a ventilator and vasopressors are given to maintain blood pressure. Okay. Next. So types of donors. Next. So I told you there were living donors and dead donors. Living donors can donate one part of kidney, blood, bone marrow. Even some cases of a living donor giving uterus donation is also being done. Part of liver, part of pancreas, part of lungs are also donated. Apart from this, after circulatory death, as I said, tissue donation is possible. But after brain death, multiple organ donation is possible. So these are the organs that can be donated after brain stem death. And that is why when a patient becomes brain stem dead, if there is a grief counselor in the hospital, many people's lives can be saved. This is how you should have an attitude towards organ donation. It is for saving lives. It is not that I'm taking something from somebody. No, I am saving somebody else's life. And that is how the grief counselors work in the hospitals. Next. There's a time limit for the transplant to happen from one donor to a recipient. Next. So you will see that there is a time limit, and this happens while within 6 hours, heart and lungs need to be transplanted. Within 12 hours, 24 hours, and 48 hours, all the other organs need to be transplanted. Corneas and skin is also retrieved within 6 hours of death. Voluntary body donation also should be done as early as possible. Within this time, if the organ is placed into the recipient, they have better outcomes for the patient. But no doctors or surgeon wants to wait for long for the organ to come. They would wish that the organ comes to their patient as soon as possible. Okay, next. Okay, I don't know if you know Tamil movies. This is a movie quiz. Do you know what movie this is? Next slide. Next slide. So this movie had somebody having a lung transplant. Next slide. I just wanted to ask you, can lungs be transplanted after circulatory death? True or false? Just think in your mind, okay, whether it is true or false, whether lungs can be transplanted after circulatory death or lungs can be transplanted only after brain death. Okay, next slide. There are a lot of myths in the public. So when we do conduct public awareness surveys, we get 40-50% people, they do know the value of organ donation, but they still have some misconceptions, and they do not want to register or do not want to pledge or do not want to take a donor card. So what are these myths? First myth is my religion forbids. Second myth is, most common myth is, the organ donation will mutilate the body. So next slide please. So when you have a religion which is like nearly 3,000 years old, all the religions always say that you have to have support other people, misfortune, people who have misfortune, they should be helped. That is what we believe in. And it is a humanitarian act. Even prominent religious leaders, recently in Karnataka itself, the state organization organized a meeting of all prominent religious leaders, and they also supported the cause of organ donation. There's a YouTube link on this Santa Sangama that happened recently. Another myth is the donated body will be mutilated, donor's body will be mutilated. This doesn't happen. Just like a person is taken for autopsy, the same cut is done from the middle of the chest to the navel, and the organs are retrieved, and surgically the body is sutured, and nobody comes to know of the donation has happened. Okay? Next slide. If the family agrees to donation, doctors will not save the patient. So this is not happens. If the doctors also know that the patient who came with a head trauma has a donor card in his pocket, the people who treat the patient first are the trauma doctors, the emergency doctors. They have nothing to do with any transplant. So they have no link with transplants, The next is donor family will have to pay. The donor family does not pay. Once the declaration of death is done, this declaration of death is done 2 times at a margin of 6 hours. 4 doctors will come and do all the tests needed for the brainstem death certification, and then only brainstem death is certified and the family is notified that the patient can no longer sustain life. Then only once the brainstem death is certified and the family agrees for organ donation, there is no more cost to the donor family. That is how each hospital works. Shreya was a girl from Pune. She was studying in Manipal in the engineering college. When she was 16 or 17, her college bus met with an accident and she lost the use of her upper arms. For a year, she tried different prosthetics and she was not able to get any dexterity in her hands. In 2017, she underwent a hand transplant. Though right now she is studying management and law, she stopped studying her in engineering. She had to give up that engineering college career, but she is completely able to look after herself. She's not dependent on anybody for anything. She's able to write, she's able to pluck flowers. So her full dexterity on all her fingers have come back. A lot of hard work goes by the recipient to work hard on the gift that they have received, and they can then have a normal life. Here she's doing a plank on the hands that she has received. She's forever grateful. In the morning, she says that she prays for her donor family, and she looks at her hands and she prays that the donor family has found peace and she is going to look after the gift well. So this is something about Shreya Siddhanagaudar. You can also check her on YouTube. She is very vocal about organ donation. In fact, for the other hand transplant patients and recipients and people on the waiting list, she does good counseling for them also. She talks of her story. She counsels them not to give up hope. Next slide. These are 2 of heroes from Tamil Nadu, both young. Both had severe head injury and passed away, and the families agreed for organ donation. Many cases have been happening in Bangalore, in Belgaum, in Dharwad, Hubli, in Mangalore. So Karnataka also has reached a very high level of efficiency in getting organ donation done. Next slide. These are some of Moon Foundation's heroes. You could identify one person from here, I think so. The boy in the family with the family is Hitendran. He was one of the first cases of Tamil Nadu's organ donation, and 2008 his donation happened, and it caused such a positive news everywhere that a lot of people registered and came to know of it, and a lot of people felt that this is a cause that they can support. So these are some other people who have become organ donors. Next. So if you wish to register, where do you go to register? You can go to Mohan Foundation's website, mohanfoundation.org. On the top corner of the home page, you have pledge organs written in green color. Click that button. Form will appear. Fill up the form, and this donor card will appear on the screen. As well as once you submit it, your donor card will come to your email, and then you can print it and keep it with you. Similarly, if you have a list of people who wish to become organ donors, we can ask our Karnataka office, Bangalore office, to send you that many donor cards. That's also possible. So, both ways we can do it. Also, a new thing that has come from 2019, on driving license, you can register yourself as an organ donor. So those of you who are going to renew your license at the age of 50 or are going to get a new license for any reason, please answer the question number 7 in the application form, which says whether you wish to be an organ donor or not. Once you are ready with that, you get a small green heart or a red heart or some form of indication in your driving license that you are an organ donor. Please remember, all your data goes to the National Registry and it is very secure data. Nobody shares this data with anyone over here. Okay? But what is more important, that if you register as to become an organ donor, you think that you will help people like Shreya when you know more. That time you have to explain to your family members that this is your wish, because at the time of death, when the grief counselors are talking, if you have spoken about it, it gives your family some form of relief that yes, I know the answer to this question. And they do say yes to donation. Many studies have been conducted showing that a person who discussed with his family, 80% of the family members say we would have kept his wish. Okay? Also, like you have invited Mohan Foundation to give a talk, initiate some sort of organ donation day in your campus. And this will help other people to know that there is something called organ donation and there is a way of saving lives and leave a legacy. That is what I mean. Yeah. Next slide. So I was talking about the courses that we offer. This is like for self-development. We have a Gift of Life one-day certificate course. You also have something for kidney, heart, liver, lungs, all these things. In addition, I request you also to visit the ambassadors page and our internship page. And if anybody wishes to become an ambassador, also train them as ambassadors, wherein you will talk about organ donation to a next other people. So next time I would listen to one of the ambassadors speak to a group like this, instead of me talking, trained ambassador can talk. We have a lot of ambassadors in Karnataka itself, recipients also, who have taken the ambassadors and are now talking to their colleagues and to their friend circle, and doing a lot of activity to create awareness in organ donation. Internships are also possible in Mohan Foundation for you to develop your skills. And you could take transplantation is a huge field. You could take a key topic in transplantation and do a 1 month or 2 month internship with us. Next. Just a thing to say that all of us can do small things, and together we can do great things. So if the Faculty of Pharmacy decides that they want 10 people to be ambassadors, 10 of you can join the course, and have an organ donation day celebrated in the entire campus. The 10 of you can improve or influence the decision making of nearly 500 other students. This is what I meant when I kept the picture here. Next slide. This is the ambassadors course. I'm talking about this because anybody can take it, It's just for lay people. It is not a technical or a professional course. Next. So this is where you can meet us, can chat with us. Please follow us on our social media handles and come to know what we are doing and what is new in the field of organ donation and transplantation. Thank you very much. Please note down our toll-free number because most of the calls that come to us is how to find an organ. Very few calls come to say that I want to be an organ donor. So you know that the rate of organ failure is very high in our country. And give this number to anybody who needs. We do answer and support patient queries also. And thank you very much for your patient listening. This shall be followed by an information on the brain death, how brain death is detected, how it is certified. Okay.
I am Dr. Sandeep Vash, and I have been a practicing neurosurgeon for the past 20 years. Over the next 5 minutes, I shall explain what brain death is. Brain death or neurological death is a term not well understood by the public. People tend to confuse brain death with coma. This animation will explain what brain death is and how it is substantially different from coma. Let us start by understanding anatomy. The brain consists of two parts, the cortex and the brainstem. The cortex is the larger part of the brain and the brainstem is the smaller. The brainstem is actually the top of the spinal cord. The cortex controls higher functioning activities such as reading, writing, and talking. If the cortex is seriously damaged, the person might enter coma and lose consciousness. But even in coma, a person might still feel pain or respond to stimuli. And sometimes a comatose patient might regain consciousness. Brain death is, however, different from coma. It's a term used to describe the whole brain dying, both the cortex and the brainstem. The brainstem is the central nervous system of the human body and the center of consciousness. If the brainstem dies, respiration would stop. Once the heart stops receiving oxygen, it too would die and stop beating, and all other organs will also die due to oxygen deprivation. How does brain death occur? If a person receives a serious blow to the head or has a major stroke, the brain might begin to swell. Since the skull is made of hard bone, it doesn't allow the brain to expand. Physicians can try medication or surgery to reduce the swelling, but if this does not succeed, the pressure on the brain can grow greater than the pressure of the beating heart. Once this happens, the heart can no longer force oxygenated blood into the brain. With no supply to the brain cells die due to the lack of oxygen. In fact, the cells don't just die. A process called lysis begins where cells begin to liquefy. This liquefaction makes the brain death irreversible. Once the brainstem dies, the person stops breathing and the heart and the rest of the organs die due to oxygen deprivation. So how do we know the brainstem has died? Modern medicine has lots of ways to determine if the brainstem has died. One way is to check for the neurological activities that the brainstem controls. If the person is not conscious, cannot breathe, cannot swallow or cough, pupils do not respond to light, these are all signs the brainstem has died. In India, the Transplantation of Human Organs Act of 1994 specifies a series of tests that need to be performed by a team of 4 doctors before brain death is declared. The tests are performed twice with an interval of 6 hours. But how is it possible for the heart of a brain dead patient to keep beating? Where does the heart get oxygen from? The patient has been put on a ventilator to help him breathe. Afterwards, the brainstem dies. Even though the brainstem is dead and the lungs no longer function, the heart continues to beat because it is artificially being supplied oxygen from the ventilator. If the brainstem and the rest of the brain is dead, what is instructing the heart to beat? The heart is independent of the brain and is simply an automatic pump. As long as the heart gets oxygen from the ventilator, it will continue beating for a short period of time. After the onset of brain death, if the deceased is left on the ventilator, how long would the dead body's heart continue to beat? The heart can beat for a few more hours, sometimes even a few weeks. On an average, the heart would beat for 2 or 3 days and then die. Brainstem death is death. It is irreversible and systemic failure of all organs is inevitable. No one has ever woken up from brain death. If brain death means the patient has died, why does the body feel warm to the touch and looks like it's sleeping? The human being, the organism, is dead, but the organs, such as the heart, are kept alive for a few more days, giving the appearance of a sleeping person. An organ can be kept alive even outside the body by giving it oxygen. But the person is dead once the brain is dead. A brain dead patient is not a person suffering from brain death. He is dead. Once death has been established, the question facing the family in that situation is what to do. Should the family wait till their loved one's heart stops beating? Or should they express their wish to donate organs and save other people's lives? Emotionally, it's a difficult choice, and every family has to do what they feel is right.
Hemel ma'am?
Mrs. Ranjini is just joining. Huh? If there are any questions till she joins, we could take the questions also.
One of our participants are asking if a diabetic patient can be an organ donor.
Yeah, no, they can pledge for organ donation because for diabetes, the first organ that gets troubled is the kidney, then the eyes. So sometimes the liver, the heart may be functioning well to save other people's lives. So diabetic people are not like contraindication to donation at all.
Okay, ma'am. Ma'am, another question is that since we know that old age people can also donate their organs to adults or children, so in that case, what would be the survival rate of the organ that is donated?
The doctors usually will accept an organ which is of good quality, and with the increase in science, even organs can be made to function as better organs. They take organs out from the donor, they put it on the table, they revive the organ on the table, and then only they do this surgery to the patient. So usually survival rate is around 10-15 years after a transplant. This is what the doctors aim to receive here. That the patient gets 10 to 15 years of good quality life. Then depending on the patient's way of life and following the regimen that the doctor says, the patients have survived even 45 years after transplant. An Indian patient in Ahmedabad is the longest surviving kidney transplant recipient.
Okay, ma'am. Another question is that does the family members have the right to donate organs of a deceased family member?
Yes, family member only have the legal consent only has to be given by the family members. The patient who passed away has no rights on his body. The next of kin has the right on the body. If it is a adult married person, the spouse, the first next of kin. If it is an adult child, both parents have to give consent. If it is a senior person, then the adult children also can give consent.
Okay, ma'am. Ma'am, so does the family member need to give consent even after pledging as organ donor?
If the family members do not agree to donation after counseling, then donation will not happen.
Okay, ma'am.
Legal consent in the act, it says there is a legal consent form. that consent form has to be signed by the family member. Usually the counselor will ask the entire family to sign, not only the next of kin. What usually happens is a young person passes away, leaves behind these two small children, 4-year-old, 10-year-old children, and a young wife. So usually the widow who has to sign, the counselor always sees that the parents of the deceased person also agree to the donation, the in-laws also agree to the donation, so that the life of the widow and her children is still safe after the patient has become an organ donor. So these sort of social precautions we always take when we are counseling.
Okay, ma'am. Ma'am, next question is what donations are dependent on the blood group and which donations are independent of blood group?
Mostly the doctors prefer the same blood group. For kidney, it is very essential to have a patient of the same blood group. There is something called HLA testing. That testing is also done. And for heart and for liver, it doesn't matter much for the blood group testing.
Dr. Hemant?
Yes?
Ma'am, Ranjini here.
Ranjini, okay. Shall we start, Emilia?
Yes,
Ranjini
ma'am.
join. Oh,
Yes.
you
Yes,
start.
ma'am.
Ranjini, you tell them when you want the next slide.
Yes, ma'am. We'll start the next one. Good afternoon. I'm Ms. Ranjini Shankar, the grief counselor, come transplant coordinator, and a project manager in Mount Foundation, working since 4 years. So I'm here to talk about grief counseling. Grief counseling itself sounds that we counsel the family who are in grief. They're already in grief. That means we are counseling the family who have lost their loved ones. So we talk about organ donation with brain dead patients for the brain dead patient families. So the grief counseling has 5 stages. All these 5 stages have to be covered to get a consent from the family. But in some cases, we don't have to put much effort with all the stages, whatever you're able to see. Like the first stage is the denial, next the anger, bargaining, depression, acceptance. Uh, but in some cases, we may have to counsel the family for nearly 15 rounds, 15 rounds also. This has been experienced in the previous case. So let me just explain one by one. So there are 5 stages in grief counseling. So they are the denial stage, anger, bargaining, depression, and acceptance. So let us start with the first stage. Next slide, please. Denial stage. Yeah, the denial stage is as soon as we have a patient who is declared brain dead, immediately we have to get the consent. I mean, first thing is we have to finish the first round of meeting with the doctors. So in the every hospital, there are 4 panel doctors who have to declare brain dead. So we have to take the opinion from all the 4 doctors to say yes, can we have this declaration done? Once we complete the declaration process, immediately then we go and talk to the family. We break the ice. It's not the grief counselor alone will do. The first thing is the doctors will break the ice of the family. They try to tell them that their loved ones are no more. So there, the first stage is the denial. The family is not ready to accept because they would have seen their loved ones, or when the patient is brought to the hospital, they would have seen them, like slightly they are breathing, or they would have seen some movements in them. So they would have thought that the patient will survive, but they will not have much knowledge about what is brain dead and why do they need 1 day's time to declare the person to be dead. They don't know exactly about brain. So they get into the denial stage. The first thing is they say no, we cannot accept this, and they say let us wait for some more time. And some families they say no, we cannot at all accept, let us wait for our one of our family doctor to come and visit here. Then we will think about it. So let them still be in the hospital. We will not disturb them much. Can we go to the next slide? Yeah, next is the anger stage. This is a very, very crucial stage where we have to handle the patient's family very, very patiently. This is the place where we have to take our time also. Very smoothly we need to handle them because their family is already in grief. They are not, they have first itself, they have not accepted. They have already denied, saying that no, we are telling them lie, that their loved ones are no more. They are not able to digest. Second thing is they show their anxiety, they show their anger out on us, saying that you should have told us before that you have no proper equipment, I mean, well treatment given here. We would have gone to any other multi speciality hospital. So, again, we counsel them, telling them that wherever you go, whichever hospital you go, whatever the treatment that we have tried giving to this patient will be the same in any other hospital. So, it is the same. We have tried our best. That is all what we will tell them. And then they will ask us for the reports because they are in anger. They have already denied. They don't want, they're not able to accept it. So what they do is they ask us for the reports of the patient. They say that they want to go to any other hospital or they want to take a second opinion from their family doctor. We don't deny that. Immediately we will arrange for all the reports, whatever is required, that we can give them. Yeah, they will go to any other hospital, they will get their second opinion. There also the result will be the same. Then, can we go to the next one, please? Yeah, and then they come back with a bargaining stage. The bargaining stage is the pleading stage. Now their anger is gone. They have understood that even in other hospital, it is the same treatment. So there they would have understood when their family doctor has told them, yes, whatever the treatment was given here was right, and whatever the declaration is done is the right process, the procedure. Then they ask us, they still have hope. They will come back with a small hope saying that, Madam, can I talk to any of the senior surgeon? Can we ask them that, is there any minute possibilities to save or survive the patient? So again, we counsel them from the basic of what is brain death. Why is that person is dead? But again, there they will start arguing with us. They ask us, no, madam, when we look from the eyes, we know that the person who is a brain dead is always on a ventilator. So from the far patient family, they ask us, no, madam, we can see him or her breathing. How, and you saying that he or she is no more. Then when we do the second declaration process, always the brain dead declaration is done twice. So after the first declaration, we will start counseling the family. Meanwhile, when for the second declaration time, we will allow the family to attend one of the physical examination test, that is the apnea test. So here what we do is two members from the family is allowed inside the ICU with the doctor, with all of us, and even the counselors are there with them all the time. Then what the doctors do, as usual, what we do in the apnea test is we remove the oxygen and we allow uh, the patient family, we explain them to observe to see whether he or she can take a second breath on their own. It's not possible because the person is already brain dead. So there we make them understand it is only because of the ventilator and the artificial oxygen supply the the person looks like as if he is breathing. So there they understand, okay, this is the procedure. So there is the trust bonding that we develop with the family. And after the bargaining stage, can we go to the next? Once they get to know, confirmed that their loved ones are no more, they get into the depression stage. Even at that stage, we are there with them Then they come down to us voluntarily and they ask us, Madam, what do we do next? I'm depressed. I don't know what to do. Then they ask their family members to come and other family cousins, everybody they come. So there also, then also again we start counseling them from the basic of what is brain. So it takes almost nearly 4 to 5 times to counsel the family. But in some cases, there are that we have taken 15 rounds of counseling for the same family before they consent. Next slide, please. And now comes the acceptance stage. In the depression stage, once they come to us, we talk to them about, then we tell them that we still have an option. You know that your loved ones cannot come back to life. She's already dead. So we have an option for you if you're okay with. This is how we talk to them. So they say immediately, they ask us, yes, ma'am, please tell us what is it. Then we talk about organ donation. Till then, none of us, either the ICU team, nor the doctors, nor the any staff of the hospital, nor the grief counselors, nobody will talk about organ donation. Once they come to the acceptance stage, but they will accept. Once we tell them that there is an option for you to assume that your loved ones are alive through someone else, you know that they cannot come back to life. But still, through someone, you can still see that your loved ones are alive. You can still give a chance, an option for someone who has to start a new life. Then immediately there is an acceptance. There are in 100% of the family, all 100% families do not accept for organ donation. But at least we have the ratio of at least 60% families nowadays, they are able to accept. Within few rounds of counseling, they understand the pain of the other family, though they have lost their loved ones. They think so practically to say yes for organ donation. Then we have the procedure for organ donation is, once we get the consent from the family, it's not only the oral consent. We take a documentation consent and then we call upon the government body, the state government body which is working for the concept of organ donation. So in Karnataka, it is Jiva Karthikate, the SOTO, who is working for the concept of organ donation here in Karnataka. So we make a call to them and we would have informed them about the consent. Then immediately they will arrange for a recipient whom they have on the waiting list. And we are still there with the family. We are there with the family till we hand over the body to the family with all the due respect. This whole process, after the consent given by the family, the process is taken for nearly 2 days. Maximum, minimum 1.5 days from the time of consent. Or sometimes, if it is an MLC case, if they have an MLC case, then definitely it will take up to 2 to 2.5 days of time. And we are there with the family even before the declaration of surrender, because we know that already we know that there are a lot of head injury cases getting inside the hospital. There are few cases whom we observe that the prognosis is very, very poor. There is no prognosis, there is no improvement though the treatment is given. So slowly we will start talking to the family and we try to be with them for as much as time that we can give them. So there is a trust bonding that we have already built with the family. And that is why they are able to accept whatever we say is yes. There is a right procedure, it is a legal procedure, and they can also follow it in the right way. So this is how the whole grief counseling goes about. So nearly 3 to 4 days we spend the time in the hospital itself with the patient family, because every stage we need to be with them to build a strong hope and trust with them. So this is the whole process of grief counseling. So let me share one incident, one case study in Limhan that we had in the year 2000, last year, 2022. After COVID, it was the first case in Limhan. So she's Miss Chaitra. It is so unexpected that nobody will even accept it so easily. That is how her case was. It was her wedding. She was just standing in her reception. During her reception, she just collapsed. That's all. It's on the family knows, and immediately she was rushed to. She was really taken to nearby hospital, and they said that she has to be taken to Nimhan's hospital. When she was brought to Nimhans, it was a post-surgical case. Immediately, there was a surgery done, and doctors tried all their best to survive the patient, but there was no response. There was no proper response for the treatment from. Hello, am I audible now?
Yes, ma'am, you're audible.
Yeah. So immediately, what happened was then we waited with the family. Immediately, we received a call from the neurosurgery department. Though we were there on ICU, we were there on rounds. We received a call from the surgery team, and the surgery team. Once they gave us a call, then we went and spoke to the HOD, and then we had another round of discussion. Then we started slowly talking to the family. The family, Chaitra's brother were alone there. They were, Chaitra has three brothers, three elder brothers, and her family is at Kolar. The next day was her wedding. And what happened was immediately when we started speaking to the brothers, they were slowly trying to tell us that they are from a very orthodox family. They have a very good, they give a lot of importance to the religious background and all that. But slowly we were just trying to understand what family is up to. They have no hope that they would never even thought that they would lose Chaitra. That is their thought. They thought that okay, madam, we have anyways postponed the wedding to after 3 months. So no worries. One thing is we have to get her back home. One as we want her to get recovered at the end. We said so. We are doing all our best. So it took nearly 2 days for us to counsel the family. Then slowly we had to break the ice of the family, where the doctors first, one of the panel doctor, neurosurgeon, was Dr. Dwarkanath, who break the ice of the patient family, and they said that the Bhavras are no more, Chaitra is no more. Family was not able to accept, they had no words, they were not even able to talk anything. Then slowly we counseled them and we told them this is what you can do. Because they had already seen us from 2 days. We were there working out for their reports. We were helping them to get all the other reports from the department or from the hospital because Nimans is a very big hospital. So they cannot keep running around from pillar to post all the time. So we are at least aware. So we were trying to help them out with all the reports and other, maybe even we were trying to take care of their even needs, maybe their water, drinking water, or maybe, this was their breakfast, or everything, to put everything in perspective, from our end, that was no information. And then later, slowly they started building a trust with us. And once we spoke to them about organ donation, immediately the elder brother accepted, whereas the younger brother did not accept. The second elder brother did not accept. Then again we did another round of counseling with the second elder brother. Then the two brothers accepted, and then it was their parents who had to accept. The family, the parents came down. Then we counseled them, we took the consent from them, and then the parents said if their aunt and uncle are also very important in the family because they are the head of the family. So we did another fourth round of counseling to them. Slowly, like this, there were people adding on for the counseling process where we took 15 rounds, 15 rounds of counseling to the family. Finally, we got the consent, And then even the family felt so proud about this donation. So this is how we counsel the family and then we got the consent. So like this, we have every case is a new learning. Every case study has a new learning. In some cases, very immediately the family accepts and they give the consent for offering. So like that, it varies from case to case. So this is all about grief counseling. Any doubts?
Thank you, Ranjini. I'll just share a
Thank you.
short video. Is there time for the recipient testimony?
Dr. Helen?
Yeah.
Ma'am, I'm in the middle of a meeting. Can I go back to the meeting again? No?
Yeah. The recipient testimony video. Yeah, thank you.
Good morning, everybody. My name is Sushma Shinde and I come from Mumbai, Maharashtra. Like any other person, I was living a normal, healthy life. I'm basically a civil engineer and I was working in IT for almost 8 years. Then in July 2008, my life changed. I had a septic abortion and because of which I had a complete loss of kidney function. I was told I am having chronic renal failure and my only options for survival are either lifelong dialysis or a kidney transplant. But I did not have a suitable live donor in my family. So we decided to register for cadaver transplant and I did so in many hospitals in Mumbai. By that time, I had to continue with my dialysis. Believe me, life on dialysis is not easy. At least for me, it was not easy. Nothing is normal. Your whole life revolves only around the dialysis center. You cannot go out like normal people. I had to quit my job of 8 years because I could not adjust with my dialysis timing. I was really frustrated and wanted to do something else. I even tried alternative therapies like acupuncture, acupressure, Ayurvedic medicine, but nothing helped because I had total loss. I had cortical necrosis of kidney and there was no hope other than transplant or dialysis. Mm, okay, in spite of being on dialysis for 4 years, I never got a call for cadaver transplant in Mumbai. Then as my father was working here in Chennai, we decided to come here and register for cadaver transplant. I registered myself here in Fortis Mallar Hospital with help of Mr. Satish. We got all the required guidance from him and I registered here in June 2012. By that time, I continued with consultation with Dr. CMT and not to mention my dialysis in Fortis. But finally, I got a call in August, 8th of August 2012, and I had my operation on surgery on 9th of August 2012. And I'm still recovering out of it, but life is better. It's really better. The first thing I'm happy about is no more dialysis for me. I can live like any other normal person, go out like a normal person, and I can even think of having kids. That is the first thing. Before the transplant, my creatine level was as high as 10.8 and it used to go up to 15 also. But now it is only 0.9. Second thing I want to say is in 4 years I had absolutely no urine output. It may seem normal to any other person who doesn't have a disease. But the day I passed my urine for the first time, that was the happiest moment in my life. You cannot imagine what it is like after 4 years. Okay, I'm really thankful to government of Tamil Nadu for giving me this chance and hospital, Fortis Mandal Hospital, and not to mention the family of deceased donor who gave me this new life. give me a new chance. I now have a future with my husband and hope to have children someday. Thank you.
Thank you. If there are any more questions, we would like to take any questions. Our seminar activity is over.
Yes, ma'am.
Sure.
Ma'am, we have questions. So Hitesh asks, which are the organs of our body that can be transplanted today? Like, are that all the organs can be transplanted, or are there specific organs?
The most transplanted organ is kidney, liver, heart, lungs, pancreas. Sometimes there is large intestine transplantation a little bit. Sometimes there is small intestine transplantation, but not very frequently. After COVID, there was a lot of lung transplantation, so the surgeons have gained a lot of experience about doing lung transplantation.
Okay, ma'am. Ma'am, next question is there any complications with respective to the size of the organs in case of organ donation from old age people to children or adults?
Yes, yes, absolutely. Adult people cannot usually give to a pediatric case, especially smaller children, because even the blood vessels are larger for adults and very small for children. So the matching doesn't happen well. For size actually matters in the heart transplantation because the heart has to be fixed within the rib cage. So size is of great importance for heart transplantation. For liver and for kidney, the size does not matter. Usually, adult liver can be nowadays adult liver donor. Um, the liver is divided into two parts, and the smaller part is given to a pediatric patient, and the larger part is given to an adult patient. So, size does matter, especially for heart transplant patients.
Okay, ma'am. Ma'am, next is can heart of a patient who died of myocardial infarction or any other cardiovascular complications can
Yeah.
be a donor for heart or for any other organ?
No, a person who dies because of MI cannot be an organ donor at all because that death is circulatory death. So that such a patient will always be a tissue donor.
Okay, ma'am. Next is there any chance to enhance the survival rate of the organ? If so, what are the ways or methods to extend the organ survival time limit before transplantation?
Usually the organ is placed in a special liquid called the UW solution that mimics the conditions within our body, and that is why the organ is able to survive for so long. There are also special machines now which are available, which can keep the organ functioning for longer duration, which allows the doctors and the surgeons to check the organ out well, and if there are any deformities, they can do it on table surgery of the organ before they give it to the recipient. It's called organobox, the special machine that has come up so that the organ is kept at normothermic, because when you keep the organ in a cold solution, there is some sort of cell death that happens. To avoid that, they have come with normothermic machines.
Okay, ma'am. Ma'am, next is which type of organ transplant has the least success rate?
Uh, it may be lungs because it's a very delicate organ, and the patient who needs a lung transplant is actually extremely sick. So that may have a lower survival rate, but the other organs will have. Lung transplant patients also live to 5 to 10 years after transplant.
Ma'am, which organ donation is the hardest to which has the hardest success rate? Like it's very difficult to do the
The
operation.
surgery, difficult surgery is a liver transplant surgery. Most difficult surgery usually is a liver transplant surgery.
Okay, ma'am. Next question we have is what is the difference between a cadaver and a dead body?
Cadaver and dead body is the same thing. A dead body is called a cadaver in a medical term. The difference is brain death and circulatory death. These are the two ways a person can die. But once a person is dead, he is a cadaver.
Okay, ma'am. Next is what is the age limit for organ transplantation, especially kidney?
As a donor, you can become a kidney donor even up to age of 80. 92 is the most senior person who has become a kidney donor. So, receiving a kidney, you can receive a kidney even at the age of 65, 70, provided you are healthy enough for the surgery.
Okay.
There's no age limit to become an organ donor.
Okay, ma'am. Next is blood group matching required for skin transplantation?
No. Skin transplantation, skin donation is usually as a bandage, as a human bandage, biological bandage it is called. Skin donation and transplantation does not mean that the skin is transplanted and it is stitched on the surface of the recipient. It is just placed on the surface. The recipient's skin then grows and this is shed out. So skin transplantation is usually done to save a patient who has huge area of burn or industrial accident or burn accident, so that they do not lose liquids and they do not get infections.
Okay, ma'am. I think it's the last question. Ma'am,
Yeah.
is there any future complication that can be observed if the organs are donated at a very young age?
For the recipient, any complication for the recipient?
Yes, no, ma'am. For the donor.
For the donor, usually donors are usually adults. No doctors would take a donation from a pediatric case. The complication usually is if the donor later on, a living donor later on in his life, develops diabetes or hypertension, then there may be some complications. But the doctors would not take a donation from a patient who has got family history of diabetes.
Okay, ma'am. Ma'am, I have a question that is, since you told pediatric patients cannot accept organs from an adult because of the size differences. So, is it not that pediatric organ donation would be much more difficult because the number of donors would be less for pediatrics?
Yes. Yeah, very true. Very true, Amelia. Pediatric donors are very rare, and we do not wish to have pediatric donors actually. But there have been donors who are very young age, which I show picture about a 15-year-old boy, a 7-year-old girl. Those are actual donors. And recently, even a 2-year-old girl was a donor in AIIMS, New Delhi. So there are cases, but they are very rare. For liver transplantation, a child who has liver disease children with liver disease is usually the doctors realize it at the time of birth itself. The patient has got some liver issue. So the parent will donate a part of the liver when the child attains a certain age where they are able to take the surgery. So liver transplantation from a parent to a child is commonly done. The only issue is with the heart and with the kidney. So for heart and kidney, we need pediatric donations for a pediatric case.
Okay, ma'am. Next is what are the complications of immunosuppressants in organ donation?
A lot of stuff about immunosuppressions after taking for recipients. They have to have a good regimen of cleanliness, not go to public spaces, crowded spaces. Skin cancers is common for recipients if they don't take care of themselves well. Different cancers may grow, not very sure, but it's a balancing act that the treating clinician does with the recipient. of how to develop this immunosuppression. And after 5-6 years, it is tapered down. The immunosuppression is tapered down. The first 2-3 years, you have to be really careful, not eat any raw food, not eat anything outside. It is a life that a patient has received, and so following what the doctor says is extremely important for the patient to keep the gift.
Okay, ma'am. Ma'am, next is any complications or difficulty faced during pancreas transplant?
Actually, I do not know this answer. Okay, I'll have to read up and send you an email about it.
Sure, ma'am. Next is hypersensitive person can be a donor to such a patient like lupus or Ronald's disease who aren't diagnosed as of now.
No, I cannot answer this. Hypersensitive. No?
Yes, ma'am. Okay, ma'am.
I'll just get back to you. Okay.
Yes, ma'am. Next is can a cancer survivor be a donor?
Very rarely cancer survivors are taken as donors because you have to look at the status of the recipient who is taking the organ. Also depends on what sort of cancer the patient has got. If it is some cancers will be on the skin and all, that will be okay. Internal organs or within the body, if there is any cancer inside, then they cannot be organ donors.
Okay, ma'am. I think that's all for the question answer session. If anybody else has any questions, please drop your questions in the chat box. Okay, so we'll move on. So it was a very interactive session, ma'am. Thank you so much for sharing the knowledge with us. So before moving on, I would like to make a small announcement. A feedback form will be sent to the registered email IDs of all the participants. And we kindly request you to take out a few seconds to fill the form. It would help us improve our next sessions. With that, I would request our respected Associate Professor, Ms. Akshata, to propose the vote of thanks for today's session.
Good afternoon, everybody. It's my honor and privilege to conclude this session by extending a vote of thanks. First of all, we are very much thankful to the management, Honorable Vice Chancellor and Pro Vice Chancellor for their continuous encouragement and support in conducting webinars. On behalf of all the faculty members of Department of Pharmacology, I thank our Dean, Dr. S. Bharat, for his support in organizing such webinars. And we are really fortunate to have an eminent speaker of today's webinar, Dr. Hemal. In spite of her busy schedule, she agreed to deliver this talk, and we are very much thankful to you, ma'am. I would also like to convey my sincere appreciation to our Department of faculty members for their support and cooperation throughout the process and arrangement to successfully conduct this webinar. On my personal behalf and on behalf of Department of Pharmacology, Faculty of Pharmacy, I profusely thank all past participants for their active participation, support, and presence in making this program a noteworthy success. Thank you, one and all.
Thank you, everyone. We have concluded the session. You can leave. Thank you, Hemal ma'am.
Thank you, ma'am.